survive not being able to live my life.
Over 200,000 cases of giant cell arteritis are diagnosed each year in the United States, limiting the lives of so many individuals. Giant cell arteritis affects the blood vessels in the temple, leading to tenderness and pain in the head, jaw, and tongue. Now, with a newly FDA-approved drug called Hemoalis, people suffering from giant cell arteritis have hope. Hemoalis is a drug that suppresses the immune system and uses steroids to limit conditional immune response. People who took Hemoalis experienced less tenderness and pain and saw an overall decrease in their giant cell arteritis symptoms. See if Hemoalis can make a difference for you. Hemoalis is proven to help people with scalp tenderness, jaw and tongue cramps, headaches, double vision, potential blindness, and joint pain. Don't use if you're allergic to Hemoalis. Before starting Hemoalis, it should be checked for tuberculosis. Increased risk of infection and lower ability to fight them may occur. Tell your healthcare provider right away about any symptoms you may have while taking Hemoalis. Side effects of Hemoalis include fever, chills, pain in the lower side of the back, trouble urinating, pain while urinating, frequent urination, unusual tiredness or weakness, hair loss, liver disease, kidney disease, increased aggressiveness and irritability, depression or suicidal tendencies.
I'm living the life I've always wanted. See what Hemoalis can do for you. What is vasculitis?
Vasculitis is known as a common autoimmune disorder and refers to inflammation of blood vessels. It causes changes in blood vessel walls by thickening, weakening, narrowing, or scarring. From these changes, the blood flow could become restricted, which can lead to damage in organs and tissues. There are many types of vasculitis classified by the cause, location, and type of vessels that are affected. One main type of vasculitis is giant cell arteritis, which is an inflammatory disease that mainly affects arteries around the head and neck.
What is giant cell arteritis?
In patients with giant cell arteritis, there are two abnormalities in the dendritic cells, which cause pathogenesis of the disease. Dendritic cells in the arteries restrict CD4 T cells. However, instead of these dendritic cells migrating to the lymph nodes, they become active while still in the arteries. Additionally, they bring adaptive T cell immune response to the area, which is usually immunoprivileged. The sustained release of interferon Y and pro-inflammatory cytokines, which regulate the differentiation and function of macrophages, by T cells causing pathogenesis in GCA. Long-term inflammation causes thickening of the artery walls and blockage of the vessels.
How does Hemoalis work against giant cell arteritis?
Hemoalis is composed of two different aspects. The steroid glycocorticoids in the drug target peptides called cytokines that the immune system immune cells release, which recruit other immune cells to the area. Targeting these cytokines and blocking their signaling lessens the immune response, since the immune cells are less aware of where the problem is. The glycocorticoids will also activate the M2 macrophages, which will lead to the production of TGF-beta and IL-10 in the patient's body. These cytokines will regulate T cells, and by blocking their activation, the decreased proliferation of T cells allows for the lessened immune response. The most effective way of administering this drug is through injection. Since we want to get as close to the site as we can, in this case the head, we are likely to inject in the jaw or neck area.
What side effects are associated with Hemoalis?
Since this drug suppresses the entire immune system, individuals taking this drug are more likely to be susceptible to illnesses and other infections. Other possibilities include fever, chills, unusual tiredness, and weakness. The drug also increases your chance of developing osteoporosis, diabetes, depression, and ulcers.
What steps should I take if I'm interested in Hemoalis?
Before taking this drug, I would recommend being tested for tuberculosis. Due to the immunosuppressive nature of this drug, we want to make sure that you are not a carrier for TB. We don't want to put you on this drug if it would mean that you would be more vulnerable to TB. So we would schedule you for a TB test before starting treatment. You would also be okay with receiving this drug as an injection, specifically an injection potentially in your neck.